We are often asked, what's the donor area for doing a hair transplant surgery? Hi, I am Dr. Arun Panda. I am a facial plastic and hair restoration surgeon in Mumbai. So here I am going to explain you what are the normal donor area for the hair transplant. So basically, if you see this young guy for whom we are going to do a 3-session hair transplant. So if you see this posterior part, the posterior part of the scalp is known as the posterior, the permanent donor zone. So basically this whole part of the scalp or the occipital area is known as permanent donor zone because the follicles here are resistant to something known as testosterone in normally in androgenetic alopecia. So they don't normally fall. That is why we take these follicles and we graft it onto the anterior part we have lost. Apart from this part of the scalp or the back part of the scalp, then come this side. So the other areas which also is considered the donor area is basically the whole of this part of the beard. So since beard has got a good density and we can also take from this beard area, this gives us a good density, good thickness, and they normally do not fall. Apart from that, the other areas which we can take from are the chest area here. So these are also the donor area which we can consider. So overall we can take about I would say about 3,500 to 4,000 from the posterior part, about 700-800 from here, and about 500 to 600 from the chest area, which makes about 5,500 grafts to create a good density all throughout the scalp. Thank you, and if you have any queries, you can always let us know. We will be more than happy to help you with any facial plastic or hair restoration queries. Thank you.